let's talk about something called acute limb ischemia. Now, that might sound like just another medical term, but it's not. It's a full-blown vascular emergency. It's a high-stakes race against the clock where every single second is absolutely critical to saving not just a limb, but a life. I mean, just listen to that. It all starts with a sudden, unbelievable bolt of pain. Patients describe it in these shocking terms, like being hit with a steel rod or getting an electric shock. This isn't a dull ache. This is the body's first, desperate, screaming alarm bell that something has gone catastrophically wrong with the blood flow. So how do doctors on the front line even begin to recognize this crisis? Well, the patient's journey starts with this dramatic explosion of symptoms, and they're known by a really memorable and powerful name that every single medical professional learns. These 6 signs, they tell a story. They're famously known as the 6 Ps. First up, you've got that excruciating pain. Then comes pallor, which is when the limb, starved of blood, turns this waxy, ghostly white. Third is pulselessness, and this one is a must for diagnosis. It means no blood is getting through, period. Then poikilothermia, which is just a fancy word for cold. The limb literally cools to room temperature. After that, the nerves start crying out, which gives you paresthesia, that awful pins and needles feeling. And the last, most terrifying sign, paralysis, the inability to move the limb. That is a very, very grave sign. And all of this brings us to a core principle, a mantra in vascular surgery. Time is muscle. You see, skeletal muscle, the stuff that lets you walk, run, and live your life, it starts to die within just 4 to 6 hours of losing its blood supply. That's not a guideline. It's a hard biological deadline. The clock is ticking. Okay, so let's zoom in. We're going to go from what we can see on the outside to the absolute microscopic chaos that's happening on the inside. I want you to think of it like a city-wide power grid failure, but it's all happening inside the tiny cells of your leg. First, let's just get a quick definition down so we're all on the same page. Ischemia. It simply means a sudden, drastic cut in the blood supply from your arteries. But the key phrase here is threatens its viability. This isn't a minor problem. This is the countdown to irreversible damage. So here's what happens. It's a chain reaction of cell death called the ischemic cascade. First, the cell's energy currency, ATP, just runs out. The cell panics, it switches to this backup generator called anaerobic metabolism, but it's super inefficient. Second, without power, the cell's security systems, these crucial ion pumps, they fail. Sodium and water flood in, making the cell swell up like a balloon, and toxic levels of calcium start building up. Finally, this calcium overload is the final straw. It flips a switch that activates enzymes that literally begin to eat the cell from the inside out. It's self-destruction. All right, let's shift scenes. We're in the emergency room now, and the medical team, they basically become detectives. They have to solve 2 huge mysteries, and they have to do it fast. Where is the blockage, and just how bad is this, really? Now, you might think they'd rush to some giant, high-tech scanner, but the first tool they grab is usually this simple, handheld Doppler. It's basically a stethoscope for blood vessels. They're listening for a pulse. A normal, healthy artery makes this sharp, punchy sound wave you can see on the right. But silence, or a weak, muffled sound, that confirms the blockage and helps them start to pinpoint where it is. With that information, they turn to this. This is the Rutherford classification. And it's not just the table. It is the roadmap that decides everything. Class 1, you're okay. The limb is viable. Class 2A, it's threatened, but we can save it. But look at Class 2B. This is the red zone. The patient is losing feeling beyond their toes, they have some muscle weakness, the limb is immediately threatened and can only be saved with urgent, right-now intervention. And then there's Class 3. It's tragic. The damage is done, and amputation is almost certainly the only option left. So once the team knows the limb is salvageable, they face this huge decision. And the path they take, it totally depends on what caused the blockage in the first place. You see, was it a clot that built up right there, or did it travel from somewhere else in the body? And that distinction is everything. An embolism is like a traveling landslide. A piece of clot, often from the heart, breaks off, travels through the bloodstream, and gets jammed downstream in an otherwise healthy artery. The onset is brutally fast. A thrombosis, though, that's more like a local pileup. It forms slowly, right on top of an artery that's already narrowed by disease. It's more gradual, and you can usually see signs of disease in the other leg, too. Figuring out which one it is dictates the entire game plan. So for the less severe cases, maybe a thrombosis in a Class 1 or 2A limb, the choice might be this: catheter-directed thrombolysis. A surgeon threads a tiny, flexible catheter right up to the face of the clot and then drips a powerful clot-busting drug directly onto it. Over a few hours, the clot just dissolves, which then uncovers the real problem, the diseased artery, so it can be fixed. But for that traveling landslide, that embolism causing severe Class 2B ischemia, there is no time to wait. The answer is surgery, and they use this brilliant invention called a Fogarty catheter. The surgeon makes a small cut in the artery, slips the deflated balloon right through the clot, inflates it on the other side, and then just pulls the whole thing out. Boom. Blood flow is restored almost instantly. So, the clot is gone, blood is flowing again, the danger's over, right? Well, this is where the story takes a really fascinating and pretty dangerous twist. It turns out the very act of saving the limb can unleash a whole new wave of problems. So let me ask you directly. Once that warm, oxygen-rich blood comes rushing back into those starving tissues, is the danger really over? You'd think so, right? But the answer, believe it or not, is a hard no. It's something called reperfusion injury. Think of it like a flash flood after a really long drought. That sudden rush of oxygen into cells that have been chemically changed by the lack of it, it triggers this massive oxidative surge and a huge inflammatory response. This second wave of damage can sometimes be even worse than the first. It's a total paradox. And this brings on system-wide consequences. Damaged muscles release a protein called myoglobin, which floods the kidneys, turns the urine a dark cola color, and can cause them to just shut down. At the same time, those dying cells dump tons of potassium into the bloodstream. That's hyperkalemia, which can trigger deadly heart rhythms. And finally, the reperfused muscles can swell up so much inside their casings that they choke off their own blood supply all over again. That's called compartment syndrome, and it requires, you guessed it, another emergency surgery. Okay, let's get to our final section and see how this journey ends. After that intense life-or-death battle to save the limb, the focus has to shift completely to making sure this crisis never, ever happens again. And this is so important. The emergency surgery or the clot-busting drugs, that's not the cure, that's the rescue. True success, true victory, is only achieved by aggressively managing the underlying disease to prevent a second attack. So what's the path forward? Well, based on the very latest 2024 guidelines, it's built on 4 pillars. First, powerful antithrombotic drugs to make the blood less sticky and less likely to clot. Second, high-intensity statins to hammer down cholesterol and stabilize the plaque in the arteries. Third, super strict blood pressure control to reduce the strain on the entire system. And finally, the lifestyle changes that are completely non-negotiable. You have to stop smoking, and you have to start a supervised exercise program. And that brings us to our final thought. While this whole situation is a terrifying emergency, the underlying artery disease that causes it, that stuff develops over decades. In many cases, it is a preventable crisis. So the question I want to leave you with is this. What steps can you take, starting today, to protect your arteries for a lifetime?